Hello, Sky. How are you today?
Christy, I'm doing well. How are you?
I'm good. Thank you for taking the time during your lunch break to meet with me for your first virtual blood pressure clinic meeting.
Yeah, thank you for working around my work schedule and being able to meet with me. I just wanted some place where I knew it would be a little bit quiet and we can talk one on one and help really manage my blood pressure because that's kind of what I'm looking for out of this.
Well, thank you for using us as a resource. And together, if you have questions, that's what we're here for, is to help you find those answers and learn more about your situation so we can help your healthcare team kind of tailor the therapy or your management so that you get the best results possible. So, I want to learn a little bit more about you. From your doctor, did they actually diagnose you with hypertension or high blood pressure?
Yeah, so I saw the doctor maybe like 2.5 weeks ago, and she said my blood pressure was really high, and she started me on a medication. I think it's the lisinopril that I'm taking every day, and I think it's 10 milligrams, if I'm remembering correctly.
What time of day do you take that medication?
I usually take it in the morning. I try to do it that way so I don't forget the rest of the day.
That's great. That's great. What about monitoring your blood pressure? Do you do that on your own at home?
So I bought the cuff that came with the program at Mathis, but I haven't been monitoring at home by myself. No.
And that is okay. We're going to get started. Exercise. So anything above your normal daily routine. What type of exercise and how much do you get each week?
Yeah, so I usually go on 2 walks during the day with my dog. I take her out in the morning and then when I get home from work, before bedtime, and we usually walk for about 30 minutes both times, so I get about an hour every day, Monday through Friday, and sometimes on the weekends, I like to walk around at the farmer's market and stuff, but other than that, nothing else really.
That's great. That's great. And not to dive too deep, I want to be respectful of your time. We'll get to know a lot more as we work together. But on the surface level for nutrition, weekly or daily, what are the things that you enjoy the most in your diet?
Yeah, I really like to incorporate some fruits and vegetables in at least 1 or 2 of my meals a day. I usually skip breakfast because 'cause I'm not hungry in the mornings. But for lunches and for dinner, I'll have some veggies, some fish, and then usually like a rice or a potato to go with that.
About how many times during the week do you eat outside of the home?
So for me personally, I would probably say about 5 times a week. I kind of find it hard for me to just cook for one person, so it's a little bit difficult. So it's just easier for me just to eat out.
Okay. Well, let's go ahead, if you don't mind, adjust your camera and let's use the blood pressure monitor that you got last week and go ahead and take a reading for me.
Sure.
I do want to ask you, have you had any caffeine or done anything strenuous in the last 30 minutes?
No, not in the last 30 minutes, no.
Fantastic. Well, relaxed, think about the beach, put both feet on the flat on the floor, and then you've got the cuff located perfectly like we talked about. Is it pretty snug under there? Can you get your
Yeah,
fingers?
I think
Okay,
so.
it looks good. It looks good. Okay, push go and let's see what we get.
All right. Okay, I got 142 over 86.
Okay, beautiful. I am making a note of that right now. Now that we have your result, I'm super excited to talk to you about your blood pressure and what we can do to help manage your blood pressure.
Perfect.